Name of your podcast?
It's just Joey Cutlass TV.
JoeyCutlass.com.
You know, Dr. Barbara Walker, founder of askadoc.com, right?
Ask Your Friendly Doc.
Askyourfriendlydoc.com. Okay.
At www.adocfriend.com.
Okay. And she also hosts a Facebook live called Real Talk on Facebook, and the Facebook address for your webpage is.
I have no idea.
We'll find it.
But you can find me at Ask Your Friendly Doc. Is yeah.
I'll put it right here on the screen so they can see it. It'll look like magic. All right.
Okay, cool.
So and Barbara, not only is she a veteran physician, you know, with over 25 years experience, right?
Over 20. Not quite 25 yet.
Oh, okay. Over 20 years experience. But she's also my sister, which is really cool because I get to brag all the time. Like, yeah, my sister's a doctor. Every time somebody argue with me or something like that, I can be like, my sister a doctor. And then I shut around and be like, no, you don't know what you're talking about. Listen, my sister's a doctor and she told me you're wrong. Blah, blah, blah. I do that all the time.
Yeah, I ain't mad at you. It'll be 25 years next year.
Right. And you went to Spelman and you did medical school at, like, was it University of Maryland and Johns Hopkins, or?
I did I have a medical degree at the University of Maryland, and I have a master's in public health from Johns Hopkins.
That's what's up. And you did some time at like other colleges too, like as like for certain classes or something like that.
Right. I've taken classes at the Medical College of Georgia and Georgia Tech also. Okay,
that's what's up. So I'm glad I got you here because, you know, Omicron has been like on the news. It's everywhere.
You said it wrong. You have to say it Omicron. Like ominous.
Omicron. Destroyer of worlds.
Destroyer. Omicron. Be afraid.
Be very afraid. But don't panic. Oh, let's shut down travel. But no, don't panic. You know, like, it's not a big deal. We're just gonna change some stuff with what you can do, but don't panic. So all right, so let's start with COVID and differentiating SARS-CoV-2 and what the virus is versus what COVID-19 as a disease is. Like, is there a differentiation? Just to give them like a ground game on COVID in the first place from a medical perspective, from your point of view, like what is COVID and what is SARS-CoV-2, and, you know, how was it spread, stuff like that, and then we'll get into Omicron.
Okay, so SARS is kind of a generic term for any respiratory virus that attacks the lungs and causes ARDS, like respiratory distress syndrome, that can potentially cause that problem. So it's kind of a generic term in a sense. COVID is a SARS-like virus. And COVID, the distinguishing thing about COVID is that it's never, well, I say never. It probably has been in humans in the past over time, but it's not typically a human infection. It's typically something that you would see in animals. For example, dogs. There have been dog variants of COVID for years, but it never jumped from dogs to people. So COVID's been around. It's just now infecting humans. And because our bodies have not experienced COVID, at least in this millennium, our bodies kind of don't know what to do with it. It's like a brand new thing to our bodies, which is why our bodies have such a hard time fighting it. Now, that doesn't apply to everybody. Pretty much every virus on the planet, including HIV, there's a certain percentage of people that are going to be naturally immune to it. Their immune system, just for whatever reason, has it figured out pretty quickly and like can take it out without a problem. So you're always going to have those people that any virus is just not going to impact them as much. But the average person with COVID, their body really is not sure how to kill it. And so you might be lucky. And that's part of why there's so much variation in symptoms. So like, let's say you're one of these people that has an immune system that can figure it out pretty quickly. Your body, the first antibody it makes takes care of it. So you experience it as a simple cold, right? That's those people. You're sick for a couple of days and then you're fine, like a regular cold. It's like, oh, COVID's no big deal, right?
Right.
That's maybe 10% of the population that has that experience where it's just a cold and no big deal, okay? Somebody who's kind of in the middle, their body has to figure it out. So the first antibodies they make don't kill it. So then your body does this thing where it gradually does a step up. Okay, so that didn't kill it. Let me be more aggressive. That didn't kill it. Let me be more aggressive. This is when you start to get into the complications. This is when you start to take out the sense of taste and smell because you made these first antibodies that were very specific and that didn't work. So then your body kind of, it's almost like if you were using like a pellet gun, right? The first wave was a pellet gun. So that didn't work. So then you get a 22 and then you lose your sense of taste and smell and that didn't work. So then you go get a 9. And at that point, you start to get severe inflammation in your lungs and shortness of breath. That still doesn't work. So then you go and get the cannon. That's when people get into big trouble because you start getting stuff like blood clots, losing legs, losing your lungs, and you're having problems with your heart. It's actually your immune system that destroys you with COVID, not COVID itself. So it's the way your immune system reacts to it that's the problem. And getting ahead of myself a little bit, that's part of why the vaccines have so many side effects too, compared to other vaccines that people have had in the past, because it takes an aggressive response to kill COVID. So if you're going to have antibodies that are going to be effective against COVID, it's got to be a fairly aggressive response. So normally, let's say for, I don't know, a regular old chickenpox virus, your body can kill that pretty easily if it has the antibodies to do it. It's like pretty straightforward. So you don't get a lot of breakthrough. You don't get a lot of, you can pretty much completely block chickenpox, right? But because COVID is harder to kill, you need a much more aggressive response. And so you might get a chickenpox vaccine and like have barely any side effects at all. But if you get a COVID vaccine, most people are going to have some side effects because your body's having to make brand new antibodies it's never made before. It kind of freaks it out a little bit. So I expected it to have a little bit more side effects than your average vaccine, just because your average vaccine is fighting things that are similar to what your body's used to anyway,
Right.
Yeah.
And just to dispel, a lot of stuff people are saying, like statistically, as far as the risk versus the benefits and all that, right? Severe hospitalization, severe COVID illness and all that stuff. The vaccine definitely can save your life, right?
Not definitely. So if you have a really weak immune system, sometimes a vaccine is not enough. So if your body can't make antibodies well, like people with lupus, people on chemo, people who have different autoimmune diseases that they're born with, their bodies have a hard time making antibodies even from a vaccine. So people like that tend to be the ones that get the breakthrough infections and can still get really sick from COVID. But your average Joe, it's going to block you from getting really sick because it introduces you to the concept before you get the virus. So it's like you kind of know this dude at this point. It's like you fought him before almost. Not exactly him, but you know how to kill him.
Right. If it's a guy on the same, standing around the same corner, who wears the same hoodie at the same time and try to jack you the same way, you know what to expect. It don't make you invincible against that dude.
Exactly.
But you got a fighting chance.
You got a chance. Yeah. You know he carries a knife. You know his MO. So you're ready. You got a gun.
Right.
Because he carries a knife, so you could just shoot him and then you're good, right?
Right. You can come prepared. You
can
a little more prepared.
You're a little bit more prepared. And that's what the vaccine does. It makes your body a little bit more prepared to deal with it because it kind of knows what it's going to be dealing with and it's ready for it. Whereas if you've never had the vaccine, your body's just like, wait, what? What? Just completely caught off guard, and you're going to wind up in the intensive care unit.
It's like if you got lost in Baltimore and, you meet this scary dude who waiting on the corner or whatever, it's a totally shocking experience because you don't know what this dude capable of, whatever. The same thing emotionally you could go through in that real scenarios, what your body probably goes through without the vaccine, right?
Right.
So it's like, you don't know you might survive it, you might not. But the thing I wanted to differentiate with you, because, a lot of people, in the media sphere, they talk about COVID, if they're the dismissal type, which is on certain news networks, versus the other news networks that dramatize everything, and like I said, in the world, the dismissal types, they'll say, well, COVID has a 99.9% survival rate or something like that. How true is that?
It's not exactly true. Mm-hmm. So this is the thing with COVID. It's not a short game virus. It's a long game virus, right? Mm-hmm. And by that I mean it does stuff to you that doesn't go away necessarily.
Right.
So for example, COVID can decimate your lungs, mm-hmm. and you may survive the initial COVID infection, but then you die 6 months later of respiratory failure from COPD and emphysema that the COVID virus caused. So that whole thing of 99.9% survival rate is kind of an underestimation. That's in the acute phase of illness, pretty much. The other thing is it doesn't account for disability. Like nobody's really talking about the disability side, partly because they only started measuring how much disability is being caused by COVID a couple of months ago, back in October. We got some diagnostic codes that we doctors can use so that it can be tracked better, like how many people wind up with disabilities from COVID. It's not looking good. Estimates I've seen is as high as 1 in 8 people wind up with some kind of long-term disability from COVID. That's 6 months after they had COVID. They still have serious enough problems that it limits their ability to function. That's 1 out of 8.
So just to break in right there, right, to focus in on that for a second. So when we see people talking about cases and deaths, those are just 2 factors, right? Like right. There's other factors, like we don't have nobody puts on blast statistics of like how many people got long-term, like you said, disabilities or unpredictable time period of disabilities or side effects from having COVID. Like we don't see those statistics ever, right?
Right.
And that's what you're saying. Like you're saying that like there's other things besides cases, deaths.
Right. It's a much more complicated story. And we don't even want to get into the money piece, right? Mm-hmm. So you take average Joe making $60,000 a year, right? Mm-hmm. He gets COVID. He's one of these people whose body's like, what the heck? They don't know how to do it. They're unvaccinated. So they're coming into this thing raw. They wind up in the intensive care unit, okay? FMLA covers you for 3 months where they can't fire you, okay? Mm. Some people have long-term disability, some people don't. Some people have good insurance, some people don't. Mm-hmm. So even with good insurance, you're gonna definitely hit your max out of pocket for the year. So you're talking most people, average person, you're gonna spend at least 10 grand on that being sick from COVID in the ICU. So you already took 10 grand out of your family's budget out the gates. 1 day in the ICU is more than 10,000. So right. If you go to ICU, you're gonna hit your max cap for the year, period. Okay. Mm-hmm. Then you got your 3 months, right, of FMLA where they can't fire you. Well, guess what? After 3 months, they can. Mm-hmm. And if you can't pay for COBRA, which is sort of like the stopgap insurance you can pay for cash from your company,
Right, which is
then
to let
now
everybody
you're
know,
uninsured.
Cobra is not this affordable
No,
little option.
Cobra's gonna run you about $1,200 a month. Keep it in mind you're not working. And most employers, you get a couple of weeks sick leave, right? But that's just 2 weeks. You've been in the hospital 3.5 months at this point.
Mm-hmm.
So you're not getting paid, and you got to come up with $1,200 a month for insurance to stay insured.
Right.
That's probably not going to happen. Now you're uninsured. Now you're amassing ginormous bills.
I am never going to financially recover from this.
Let's say you survive, you wind up getting discharged from the hospital 4 months later. Your lungs are fried. You really need a lung transplant, but now you're uninsured.
Mm. Yeah.
Guess what? You're not getting a lung transplant.
Game over.
You can apply for disability. It takes at least a year to get on Medicare once you qualify for disability. Up until just recently, there was no code for post-COVID syndrome. So it was really hard to get disability from COVID. That's gotten better. But even if you are successful, okay, yeah, this person has clear severe lung disease, they're clearly disabled, you're not going to get insurance for a year.
Right. Yo, so, I want to do a misinformation point. Like, I'm trying to pick out different things that I know people use as misinformation, as you say it. Mm-hmm. So you said that, y'all didn't have a code until a certain point in time for post. So elaborate on what a lot of people on this is a hoax, is BS stuff. When they say that, hospitals, they get more money for each person they had COVID. Can you elaborate on that and explain, A, is that true? B, why? And C, is it some kind of scam, or is this something that people just don't understand because they're not in the medical world?
It's something people don't understand because they're not in the medical world. So you do get paid more money for a COVID patient to accommodate for the extra protective equipment you have to use for COVID patients.
Right. Okay.
It's nominal. It's not enough that's worth lying about. It's not like you get an extra 10K a day or something for somebody having COVID. Like I was telling you, average one day in an ICU is between $15,000 and $20,000 for one day, no matter why you're in there.
Right. That's about how much it was when I was there.
Yeah. About 15, 20K a day is what you can pretty much depend on. With a COVID patient, you'll get an extra $1,500. That's all we're talking about.
And that's something that no institution, even if they're totally strapped, would like make up.
And risk fraud and abuse charges to get an extra $1,500 on top of 20K. That doesn't even make sense.
No. Okay.
It doesn't even make sense. And yeah, you could say, well, it adds up. If they're in there 10 days, that's, $15,000 or whatever. But there are very few things that are going to keep you in an ICU for that long.
They're trying to get you out of there. They're trying to get you alive. They're trying to keep you alive and healthy, and bye-bye. They're not trying to nurse you and keep you there. Oh, you want some porridge for 2 weeks?
Right. And we're talking ICU. If you're talking about like in the ER per se, we're talking about an extra $50. We're not even talking that. Mm-hmm. For extra protective equipment and whatnot. And it doesn't even cover the cost of the extra protective equipment. That's the other piece. Mm-hmm. So like you're talking about, we're getting this extra money for COVID patients, just the gowns and gloves that you have to change patient to patient, and the way you have to basically replace all your protective gear between each patient when you're in the ICU with COVID patients, that's going to run you more than $1,500 a day.
Right.
That just from one patient, that's going to run you more than $1,500 a day. You think about how many times nurses have to in and out into that room, mm-hmm. and how many times you've got to be changing equipment in between patients. That's more than $1,500 a day. So It's like you're not even getting enough to make it worth it. You see what I'm saying? So it
to be some kind of scam or something.
Exactly. Right. It doesn't. That argument has never made sense. It's not a thing. They have other ways of ripping you off. They're gonna charge you $50 for aspirin at the hospital.
Right.
But they're not making up COVID patients just so they can get more money.